SORMAS, the Surveillance, Outbreak Response Management and Analysis System. How to use SORMAS as a surveillance officer. As a surveillance officer, you are responsible to confirm infectious cases and rumors all over your region. With the help of SORMAS, you are able to save many lives. Whenever a suspected case of any notifiable disease is created in SORMAS, you will get an automatic notification on your tablet. In case the health facilities are not using SORMAS, you may receive notifications via phone call, SMS, or paper forms. In that case, you are responsible for creating the case within SORMAS. To do so, go to the Cases tab and create a new case. Click the plus sign to create a new case and fill in the name and the suspected disease. As all requested information within SORMAS is dependent on the type of the disease, all required information is marked with a red star and needs to be filled in before saving. Regardless of whether the first information on a case was entered by hospital informants or by yourself, you will have to investigate more by visiting the patient and asking additional questions. You can then fill in all the missing information. In the case list directory, you will find all new cases which have not yet been investigated under Pending Investigation. Click on the patient name, which gives you access to the case data. You have to fill in the last digit of the EPID number. Otherwise, you won't be able to continue. Set the case classification from Not Yet Classified to either Not a Case or a Suspected Case. Press Save. The Patient tab opens next. Fill in all the patient information available to you, or update the data when necessary. To register the address, press the Location button. Again, press Save when you are done. The system guides you automatically to the Hospitalization tab. Please save after entering each hospitalization. Fill in all additional information about the case. If the patient was already discharged, please set the date. Choose Unknown if information is not available at the moment. You can later update and complete it. Save again. In the Symptoms tab, please update the symptoms. If none are entered into SORMAS, do so one by one. Press Unknown if you are not sure about specific symptoms. Press Set Clear to No for all other symptoms which are not experienced by the patient. Press Save. Information in the Epidemiological Data tab is about contact with other people or animals. SORMAS will only present questions that are relevant for this disease, so please answer them all. If the patient traveled, choose Travel, and by pressing the plus button next to it, enter the details. Continue by saving. Contact tracing is not required for every disease. If contact tracing is required, SORMAS offers you a platform to create contacts. Therefore, press the plus button on the right top and enter the available information about each person the case may have had contact with. In the Samples tab, please press the plus button to add each sample that has been taken and indicate to which laboratory it has been sent. The responsible laboratory will receive a notification that a sample is on the way. Last tab in line is the Task tab. Here you will see tasks which the surveillance supervisor may have sent you, in case additional information is missing for this case. They may ask you to re-check for specific symptoms or collect other information. When you are done with the task, press the Save button, followed by Done button. When working with SORMAS, please remember to check for new tasks periodically by dragging the window down or pressing the synchronization symbol. In the Reports menu, you can see all reports of each hospital. You can see the number of cases of a particular EPI week and the number of confirmed and not confirmed cases. In the Events menu, you see all events taking place in your district. You can add new events or rumors if you encounter such during your investigation. In the dashboard, there is a summary overview of all the cases, contacts and samples to keep track on everything within your district. If you have any questions, review this tutorial again or read the user instructions. You may also contact your supervisor or the SORMAS support team.